Hi, my name is Shami bin Swaidi, and firstly, I will explain the history of basic appearance of the human immunodeficiency virus, or known as HIV. HIV infection in human came from a type of chimpanzee in Central Africa. The chimpanzee version of the virus is called simian immunodeficiency virus. It was probably passed to human when human hunted this chimpanzee for meat and came in contact with their infected blood. Scientists used the sample to create family tree of HIV transmission. By doing this, they were able to trace the first transmission of SIV to HIV in humans, which they conclude took place around 1920, also in Kinshasa. Many of first cases of AIDS were recorded there too. Then, if the patient of HIV lasts untreated, HIV can lead to the disease AIDS, which is acquired immunodeficiency syndrome. AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. In the US, most people with HIV do not develop AIDS because taking HIV medicine as prescribed stop the progression of the disease. Without HIV medicine, people with AIDS typically survive about 3 years. Once someone has a dangerous opportunistic illness, life expectancy without treatment for to about 1 year. HIV medicine can still help people at this stage of HIV infections, and it can even be life-saving. But people who start HIV medicine soon after they get HIV experience more benefits. That's why HIV testing is so important.
Next, introduction to HIV. HIV, short for human immunodeficiency virus, is the virus that causes HIV infection. When the virus enters the body, it primarily targets a specific type of white blood cell called CD4 cells. HIV specifically targets and kills CD4 cells, which are crucial infection-fighting cells of the immune system. As the number of CD4 cells decreases, the body's ability to fight infections and certain malignancies becomes compromised. Without treatment, HIV progressively weakens the immune system, leading to the development of AIDS. HIV can be transmitted through certain body fluids, including blood, semen, vaginal fluids, and breast milk. Unprotected sexual intercourse, sharing needles or syringes, and mother-to-child transmission during childbirth or breastfeeding are common routes of transmission. However, it's important to note that HIV is not transmitted through casual contact, objects, air, water, or insect bites. In the early stages of HIV infection, individuals may experience flu-like symptoms including persistent fever, fatigue, and swollen lymph nodes. However, it's important to note that these symptoms can vary from person to person, and some individuals may not experience any noticeable symptoms at all. Diagnosing HIV involves specific laboratory tests that detect the presence of HIV antibodies or the virus itself. These tests can be conducted through blood, saliva, or urine samples. It's important to remember that proper testing and counseling are crucial for accurate diagnosis and guidance. However, it's essential to remember that HIV is a manageable condition with proper medical care, treatment, and support. Antiretroviral therapy, ARTs, plays a key role in managing HIV by suppressing the virus, allowing individuals to lead long and healthy lives.
Moving on to the pathogenicity of HIV. The pathogenicity of HIV refers to the mechanism through which the virus causes disease progression and leads to immune system dysfunction. The first step is entry and attachment. The virus targets specific cells expressing CD4 receptor, primarily CD4 plus T cells, macrophages, and dendritic cells. The second step is fusion and entry. Once attached, the viral envelope fuses with the host cell membrane, allowing the viral genetic material RNA and enzymes to enter the cell. The third part is integration. The viral DNA is transported into the nucleus of the host cell, where it integrates into the host cell's DNA with the help of enzyme integrase. The fourth step is replication and transcription. Once integrated, the viral DNA produces new viral RNA and viral proteins using the host cell's machinery. The fifth step is budding and maturation. The new viral particles move toward the cell surface, where they bud off from the infected cells, acquiring an envelope derived from the host cell membrane. The sixth step is infection and immune response. The newly produced HIV particles can infect nearby CD4 plus T cells, macrophages, and other target cells, continuing the cycles of viral replication. The seventh step is the immune system dysfunction. The ongoing destruction of CD4 plus T cells and the inability of the immune system to regenerate them at the same rate leads to a gradual decline in the immune function of the infected individual. The eighth step is progression to AIDS. When the CD4 plus T cells counts fall below a certain threshold, the individual is considered to have acquired immunodeficiency syndrome, AIDS.
The HIV epidemic has already devastated many individuals, families, and communities. So today, I'm going to explain on how this human immunodeficiency virus has affected humans into these three factors, which is socioeconomics, health, and emotion. People with HIV have a higher chance of developing a mood, anxiety, and cognitive disorder. For example, depression is one of the most common mental health faced by people with HIV. So, to understand how living with HIV can affect mental health and knowing what resources are available can make it easier for people to manage their overall health and well-being. It is common for people with HIV have other related health issues. Some may be related to the HIV or the treatment itself, but some may be completely unrelated. For example, children's health and nutrition are compromised. Most HIV-affected children do not have enough nutritious food and suffer from malnutrition. Other than that, AIDS increased a person's risk for many infections, including herpes virus. Lastly, HIV put a serious challenge to the economic development. Social stigma on the HIV patient has led to a variety of negative impact to the patient itself, and the big part of it was the loss of employment and education. This type of discrimination caused children to drop from their school and find an early employment to cover their medical expenses and household, since the medical treatment is not cheap, especially towards the poor people. So, there are some of the examples on how HIV has affected human life and our society.
Hi, my name is Nushahira Izzati binti Roslan, and I'm gonna explain on my part about how to control the disease. The government plays a big role in curbing this situation to be under control. One of the effective steps that have been taken is by organizing the Needle Syringe Exchange Program and SEP Malaysia. These programs target the drug users where they are the biggest contributors to AIDS. What does these programs do? Basically, the used needle and syringe are exchanged with the new and sterile one. The objective from an SEP is to reduce the rate of HIV and other sexual transmitted disease among the drug users and their sexual partners. Next, the community also needs to help the government by knowing all the important information in dealing with HIV. So, what the actions that can be done by us? First, by using the sex protection, such as condom. Condom is effectively in preventing the HIV and any other sexual transmitted disease among their interaction. Second, for the mother-to-be, please go for a diagnosis before getting pregnant, because the earlier the HIV detected can be effective towards the medicine taken and also can secure the baby from getting transmitted towards the HIV. Other than that, through the medication, there are two types of medicines that can be taken. First, PrEP or pre-exposure prophylaxis. This medication is taken by the people who do not have HIV but want to take it in order to prevent them getting infected later on. And the second one is PEP or post-exposure prophylaxis. These need to be taken by the people who already exposed with the HIV in order to prevent it from getting worse. So that's all from my part. Thank you.